Hi, my name is Alice, and I am delighted to share my PowerPoint presentation with you on the ethical and policy aspects of care coordination, and I hope you enjoy it. During this presentation, I will serve as your guide. Let's begin by defining some of the words used in this presentation so that you may understand the reason for this presentation. Introduction: Ethical and policy factors in care coordination. Healthcare ethics encompass the variables that guarantee healthcare is handled in a moral and upright manner, without regard to the consequences of the treatment. As a result, healthcare practitioners may be certain that their efforts will positively impact the industry. When we talk about healthcare policies, we're talking about the policies that have been put in place to meet government and stakeholder expectations while adhering to the rules that have been set down. Though federal, state, and local governments are often responsible for creating the policies, healthcare regulatory authorities may also be engaged in the process. Both of these elements are essential if care coordination is to be improved. The American Nursing Association's ANA Code of Ethics, which serves as a policy statement and conforms to ethical values and advocacy for nurses, must be followed by nurses, and nurses must be held accountable. Additionally, it has been determined that teamwork is the best strategy to meet these characteristics. Everyone engaged, from patients and families to healthcare practitioners, must follow ethical and regulatory norms at all times. Haddad and Geiger, 2018. This presentation will concentrate on long-term care institutions, including nursing homes. Consider the following ethical and policy considerations while developing care coordination strategy, and having a care coordination strategy is crucial and critical for the residents of these institutions since they need long-term care. A nursing home refers to a facility that provides long-term care for patients outside the hospital. These institutions are primarily intended for the aged, mentally sick, physically disabled, and other critically ill individuals. Objectives: coordination of care and to promote a safe and more effective care is one objective. Another one is the relationship between HIPAA and the Affordable Care Act, along with care coordination. Objective: a policy requirement raised an ethical dilemma for care coordination. Objective: nursing and the code of ethics that serve as a guide for carrying out the responsibilities and obligations of the profession as nurses are held accountable and to a higher standard. And the last objective, Healthy People 2020 objectives described by the CDC to improve the health of all groups of people. The fourth slide talks about care coordination. Patients' needs are best served by bringing together a wide range of resources, including doctors, nurses, and other healthcare professionals. It entails developing a strategy and working with other stakeholders to improve a patient's health and improve patient outcomes to avoid hospital readmissions for inpatient and outpatient care. Care coordination and care continuums are essential in nursing homes because of this unique characteristic of the setting. Patients' well-being and quality of life may be improved while coping with these diseases if these treatment components are handled correctly. PowerPoint slide number 5. The Affordable Care Act and government policies. This act was signed into law by President Obama in 2010. The government, as previously stated, is tasked with formulating politics and standards to guide the delivery of health care. Specific government policies have been found as having a significant impact on the patient, with many benefits for those who qualify when it comes to adopting care coordination in nursing homes and other facilities like this. Many examples of government policies have had a significant impact on healthcare delivery, but the Affordable Care Act is the most prominent, McIntyre and Song 2019. As a result of the law's implementation, more Americans may now access health care, which has been good for the country's health. However, the increasing number of patients has necessitated greater care coordination. The plan has affected several facilities, including nursing homes, and several amendments have been developed to improve this aspect. PowerPoint slide number 6. Government policy, HIPAA. This law was passed in 1996. The Health Insurance Portability and Accountability Act, enacted in 1996, attempts to keep healthcare costs as low as possible so that low-income families are able to afford it. Because of this, the insurance plans of healthcare workers will continue to be valid even if they relocate to a different state. Cohen and Mello 2018. As a consequence of the legislation, healthcare practitioners are better able to give high-quality care to their patients than they were before. Another advantage of these policies is that they have made healthcare more affordable for many people. Cohen and Mello 2018. Other parts of the legislation include protections to keep patient information private and secure, such as the privacy rule. Each of these factors has a significant influence on the efficacy of the care coordination plan. PowerPoint slide number 7 talks about policy provision with dilemma. The Affordable Care Act of 2019 has sparked controversy about ethics and unconstitutional rights to mandate health care insurance against one's will. People have indeed questioned the viability of the legislation in light of the method by which it is intended to provide access to health care for everyone. Concerns about minimum care levels and Medicaid contributions are causing anxiety among the general population. McIntyre and Song 2019. Additionally, the legislation has sparked a debate about the distribution of limited resources and exacerbating the ethical quandary in the decision-making process of being right or wrong. PowerPoint slide number 8 talks about the policy provision with HIPAA dilemma. The HIPAA privacy regulation policy raises several difficult ethical questions. A third party knowing a patient's medical requirements and records are essential for nursing facilities that specialize in caring for the mentally ill or elderly patients so that the right treatment plan can be developed. Cohen and Mello 2018. Involving third parties have been a substantial impact on the privacy and confidentiality of patient information. PowerPoint slide number 9 talks about the ethics code And it entails, in this code of nursing ethics, there are 9 ethical provisions that help guide the decision-making process that nurses adhere to uphold. Also, a nurse's job is to treat each patient with care and respect for their inherent dignity, values, and particular characteristics. Patients are the main focus of a nurse, regardless of the patient's age, ethnicity, or socioeconomic status. The nurse promotes, defends, and advocates for the patient's health, safety, and rights as part of their nursing responsibility and judgment. To ensure that their patients get the best possible care, the nurses are in charge of making choices and implementing those decisions. Nurses are held to the same standard as everyone else when it comes to their duties, which include promoting health and safety, maintaining personal integrity and competence, and pursuing lifelong learning. Sorry about the messages. The nurse's responsibility is to create, maintain, and develop an ethical working environment, either individually or collectively. PowerPoint slide number 10. Code of Ethics continued. To be competent and knowledgeable in any function or content, nurses must adhere to professional norms and intellectual study and research. Health diplomacy, the reduction of health inequities, and the protection of human rights should be promoted by nurses working with other professionals and patients according to the ANA and their guidelines. The last code of ethics is nursing ideals. Professional ethics and social justice should be included in nursing and healthcare policy. PowerPoint slide number 11 talks about Healthy People 2020 social factors. Healthcare must be provided in an atmosphere that promotes health and well-being. Social factors must be improved to further this goal. Resource availability, social support, access to healthcare, incorporation of community resources, and following up with individuals will improve care coordination and will add more resources in helping others with access to better healthcare. It is important to note that nursing homes offer more than healthcare, and social factors play a significant role in improving healthcare delivery and service to this population because at times the focus is more on hospitals rather than nursing homes. In conclusion, which I'm going to talk about in this last PowerPoint, in conclusion, the effectiveness of the care coordination strategy depends on ethical safety, reliability, and policy considerations to make this policy successful. Obamacare, HIPAA, and CON, to name a few, are all vital components of a successful healthcare system. The ANA Code of Ethics for Nurses substantially influences the plan's performance. Social awareness on health has been emphasized by Healthy People 2020 as critical to be the patient's plan success. The plan's success is dependent on ensuring that all of these elements are in sync. These are my references. I have also included the speaker notes with this PowerPoint presentation. And again, these are my references. I also want to thank you for listening to my PowerPoint presentation. And again, I hope you enjoyed it. My name is Alice Hill. Thank you.